Ever pondered upon the significance of understanding aspiration during induction? It is a crucial topic often overlooked in the hustle and bustle of healthcare practices. Aspiration during induction refers to the unfortunate event when a patient under the process of anesthesia induction inhales foreign materials into the lungs. This can be anything from food particles to gastric content, and as you can imagine, it's a situation that we, especially those in the field of anesthesiology, strive to avoid. The implications of such an event can be severe, leading to complications that could potentially threaten a patient's life. But here's the good news. With the right knowledge and precautions, the risk of aspiration can be substantially reduced. This involves understanding the risk factors that make aspiration more likely and implementing preventive measures to mitigate these risks. In this video, we will delve deeper into this subject, discussing its risk factors, preventive measures, and what to do in case of emergencies. Firstly, we'll unravel the risk factors associated with aspiration during induction. The risk of aspiration can be influenced by a myriad of factors, some of which include obesity, gastroesophageal reflux disease, known as GERD, and emergency surgeries. Now let's dive a bit deeper into each of these factors. Starting with obesity, the risk of aspiration is increased in individuals with a higher body mass index. This is due to the increased pressure on the abdomen, which can lead to regurgitation of stomach contents into the esophagus and potentially the lungs, resulting in aspiration. Next, we have GERD. This condition is characterized by a weak lower esophageal sphincter. This weakness allows stomach acid and other contents to flow back into the esophagus and possibly the lungs, increasing the risk of aspiration. The third factor we'll discuss is emergency surgeries. These procedures often don't allow for the standard fasting period before anesthesia, which can increase the chance of stomach contents being present and thus heighten the risk of aspiration. There are also other factors that could potentially increase the risk of aspiration during induction. These include conditions like hiatal hernias, pregnancy, and certain medications that slow down the emptying of the stomach. Now, why is understanding these risk factors so crucial? Well, by being aware of these factors, healthcare professionals can make informed decisions regarding the patient's preoperative care. This could involve adjusting induction techniques for obese patients, prescribing medications to control GERD symptoms, or ensuring adequate fasting periods for elective surgeries. In essence, understanding these risk factors is a key step in preventing aspiration. It allows for the implementation of appropriate safety measures and the customization of care to each patient's unique needs. By knowing what to look out for and how to adjust care accordingly, healthcare professionals can significantly reduce the risk of aspiration during induction. Understanding these risk factors enables healthcare professionals to take necessary precautions and reduce the likelihood of aspiration. Now that we have uncovered the risk factors, let's move to the preventive measures that can be taken. First and foremost, fasting guidelines. The traditional guideline is to fast for a minimum of 6 hours for solids and 2 hours for clear liquids. However, these guidelines are under constant review and may be modified based on individual patient conditions. Next, the use of drugs. Certain medications, like H2 receptor antagonists or proton pump inhibitors, can be administered to reduce stomach acidity, thereby minimizing the risk of lung damage in case of aspiration. Metoclopramide, a prokinetic agent, can also be used to speed up gastric emptying. Remember, the goal is to reduce both the volume and acidity of gastric contents. Then we have patient positioning. Elevating the head of the bed to about 30 degrees, also known as the semi-Fowler's position, can help prevent aspiration by using gravity to keep stomach contents down. In the same vein, the left lateral decubitus position, where the patient is lying on their left side, can be beneficial. This position allows the stomach to hang down, creating a natural barrier against the backflow of contents. Let's not forget about cricoid pressure, often referred to as the Sellick's maneuver. When applied correctly, this technique can prevent regurgitation during the induction of anesthesia. However, it's worth noting that the effectiveness of this maneuver is a topic of ongoing debate. Lastly, the importance of good communication cannot be overstated. Keeping patients informed about why they need to fast or why a certain position is necessary can increase their cooperation and ultimately contribute to a safer induction. So there you have it. Fasting guidelines, use of drugs, patient positioning, cricoid pressure, and patient communication. Each of these measures plays a crucial role in reducing the risk of aspiration, and it's our responsibility as healthcare professionals to implement them effectively. Adopting these preventive measures can significantly minimize the risk of aspiration during induction. But what if a patient vomits right before induction? Let's find out. Imagine this scenario. It's a situation no healthcare professional wants to face, but it's essential to be prepared. Your patient, seemingly stable, suddenly experiences a vomiting episode just before the planned induction of anesthesia. What do? Your immediate response should be to protect the airway. This is the priority. The patient's head should be turned to the side, allowing the vomitus to exit the mouth and not enter the respiratory tract. This is known as the recovery position, and it greatly reduces the risk of aspiration. Next, you must suction the oral cavity. It's crucial to remove as much vomitus as possible to prevent aspiration. This can be done using a Yankauer suction or similar device. The suction should be applied gently and carefully to avoid causing further distress or damage to the patient. Reassess the patient's condition. Is the patient stable? Is the patient's breathing unobstructed and normal? Is there any sign of aspiration? If there's any doubt, it's better to err on the side of caution. In some cases, you may need to delay the procedure. This decision will depend on the urgency of the surgery and the patient's overall health. If the patient has aspirated, it's essential to provide appropriate care, which may include supplemental oxygen, bronchodilators, and in severe cases, mechanical ventilation. Remember, every case is unique. The patient's underlying health, the nature of the surgery, and the severity of the vomiting episode will all influence your decision-making process. It's also worth noting that this emergency situation underscores the importance of the preventive measures we discussed earlier. Adequate fasting, appropriate patient positioning, and the use of antiemetics can all help to prevent such emergencies. Immediate and appropriate response to such situations can prevent serious complications. No matter how unsettling the situation may be, remember that your swift actions can truly make a difference in the patient's outcome. So stay calm, stay focused, and most importantly, stay prepared. And what if a patient vomits or aspirates upon or after induction? Let's explore. In the unwanted event that a patient vomits or aspirates during or after induction, the immediate course of action is crucial. The first step, without any hesitation, should be to turn the patient on their side. This action helps to limit the spread of vomitus within the airway, reducing the risk of further aspiration. Next, you should employ suction. Suctioning the oropharynx and hypopharynx can help remove as much of the aspirated material as possible, and this should be done as quickly and effectively as you can. Remember, every second counts in such situations, and a swift response can make a significant difference in the patient's outcome. Once the immediate threat is addressed, it's time to secure the airway. This is typically done through endotracheal intubation. In some cases, you might find that a laryngeal mask airway is appropriate. However, this decision should be based on the patient's condition and the clinician's judgment. After securing the airway, it's important to evaluate and monitor the patient's respiratory status. This might include chest radiography or bronchoscopy, depending on the severity of the aspiration and the patient's response to initial management. Now let's talk about post-operative care. If aspiration has occurred, the patient may require a more intensive level of care post-operatively. This could range from extended observation to admission to an intensive care unit. The aim here is to manage potential complications, such as aspiration pneumonia, which can be life-threatening if not addressed promptly and appropriately. In conclusion, dealing with aspiration upon or after induction requires immediate action, a clear mind, and quick decisions. From turning the patient on their side to suctioning, securing the airway, and planning for post-operative care, each step plays a crucial role in patient safety and recovery. Prompt and effective management of these situations is crucial to mitigate the consequences of aspiration. To wrap up, let's quickly recap the key points covered in this video. We've talked about the importance of understanding aspiration during induction, a potentially serious complication that can have severe consequences. Recognizing risk factors is the first step to prevention. These can include obesity, pregnancy, and gastroesophageal reflux disease, among others. We also discussed preventive measures that healthcare professionals can take. These range from ensuring adequate fasting times to using specific induction techniques and medications. But what if the unexpected happens? We explored how to manage emergencies both before and after induction. From lateral positioning to rapid sequence induction, every action is crucial in these high-stakes situations. And if aspiration does occur, Prompt recognition and appropriate management can make all the difference. This can include interventions such as suctioning and bronchoscopy, as well as antibiotics and supportive care. Remember, understanding and appropriately managing aspiration during induction can make a significant difference in patient safety and outcomes.